أهلا بكم جميعا. دائرة الصحة العامة ترحب بكم وتسعدها استضافة صديقة بصيري. Welcome everyone. We are happy today to have our guest speaker Sadiqa Basiri. She is here to talk to us about healthcare in Canada and explain to our newcomers how can they navigate this new system for them. Welcome, Sadiqa.
Thank you, Hadi, for having me. سلامونه ز خپل وړاندې کومه د هغه افغانان د پارت نوی داخل دی اتاوا ته و همچنان سلامای خود پیش میکنم به افغانایی که تازه وارد شدن کانادا. برنامه امروز ما در مورد سیستم صحی کانادا است. دیگه به این خاطر اگر شما سوال داشته باشین لطفاً شما سوالایتان نوشته کنین یا داشت بگیرین و میشه در آخر برنامه سرش گپ بزنیم و در ضمن اگر کدام مشکلی داشتین نشنیدین هم لطفاً ما را در قسمتی که مسیج است یا چت است میشه در اونجا مسیج تان بگذارین. نو که تاسو ما اوري او په زمين کې تاسو کوم پوښتنه لري سوال لري نو تاسو نه هیله کوم چې خپل مسیجونه ولیکئ او که چیرې تاسو نه اوري یا کوم بل مشکل واقع سي نو تاسو کولای شئ چې په چت کې موږ ته خپل پیغام ولیکئ. نو راځئ چې نن موږ خپل برنامه شروع کړو چې د کانادا د صحت سیستم سره هم کار کوي. نو زه به ډیره برنامه په انګلیسي بلکې ټوله برنامه په انګلیسي کې مخکې بیایم لیکن که چیرې ماته سوال پیدا سو یا تاسو سوال وکړو نو حتما زه به په دري یا پښتو کې ترجمه کوم. So let's get started.
فقط أحب أن أنوه أن الحلقة ستكون باللغة الإنجليزية وبعض الترجمة للباشتو والداري ويمكن أيضا أن أساعدكم في الترجمة إلى اللغة العربية. تفضلي.
Thank you. So first of all, I'll briefly introduce myself and also my organization. Once again, I'm very pleased to have you all on this beautiful snowy day, although there are not a lot of people who enjoy snow, but I do, so my apologies who don't like snow. My name is Sadiqa Basiri, and I work as a multicultural health navigator with Ottawa Newcomer Health Centre, which works closely with community partners that are working with newcomers and immigrant communities. So as you could see from the title of my presentation, today we'll be talking a lot about how the Canadian healthcare system works. There will be a brief intro of the Multicultural Health Navigator program, and then what are the first steps that are important for newcomers to know, and it will be followed by health coverage, healthcare facilities, responsibilities and rights as a patient or service user, and then how can you reach to my program, the Multicultural Health Navigator, for your health needs, and we'll also share some available services that you could use and you could go back to. So the Multicultural Health Navigator program was implemented out of a discussion at the OHIP, which is the Ottawa Local Immigration Partnership Program. And OHIP partners had identified that although there are numerous services available in the city, but newcomers are not necessarily using them. It was identified that access to services was a challenge due to newcomers, indeed many newcomers, not knowing what the services are, and also because of some language challenges. And we also identified that maybe the services were not culturally appropriate. This program gained quite a bit of reputation after 1 year of its implementation. While it was a pilot project, it became a permanent program after a successful evaluation in 2015. So right now we are 9 multicultural health navigators, and we provide services in 9 different languages: Arabic, Dari, Farsi, French, Nepali, Pashto, Somali, Spanish, and Swahili so far. So and who is eligible for our services at Multicultural Health Navigator program? We serve anyone basically living in Champlain region or in Ottawa. And how do we define a newcomer? We don't have a very specific definition for that, but we have a kind of loose definition. So basically anyone who does not have status in Canada, but that does not include visitors, or anyone that is a low income, that income does not matter, or the status of their education or their background of education does not matter. Also, we provide services to clients with chronic health, chronic diseases, or those who need social services or social support. So basically the service is open to anyone, regardless of the status. And sometimes our newcomers could be those immigrants who have been here in Canada for years, but for some reason they have not been able to use community services. So what is the goal of our program? Basically, it is to educate clients so that they are able to navigate the Canadian healthcare system, and so that they have control of their own health. We also play a role in bridging the gap between clients and service provider, which we do through referrals to our partner organizations. We try to encourage service providers and educate them on providing more inclusive and culturally appropriate care. We advocate on behalf of our clients with service users and on different health facilities. The overall goal is to empower our clients to be able to navigate the Canadian healthcare system on their own. And we usually work with our clients for up to 2 years. And after that, we hope that they are enabled enough to navigate the Canadian healthcare system. So now let's go directly to the Canadian healthcare system. What are the first few things that needs to be addressed? So there are certain responsibilities you need to fulfill in order to have a pleasant experience. Remember that you are in charge of your health. There are many options and choices you have, but everything has two sides, and same, it has consequences. So it is always best to ask a lot of questions and have all of the information before making a decision about your health. We'll talk about responsibilities more afterward, but let's start with the first basics. So what is initial medical assessment, or IMA? You'll hear this acronym over and over again, especially if you have just entered the country. So your responsibility and your health history will be established here with a licensed primary health care provider. It could be a medical doctor or physician, or it could be a nurse practitioner. And what you'll do is, or what the service providers and you will be doing is basically going for a blood test or blood work. You'll be asked questions about the urgent medical issues that you're facing, or any acute or urgent medical attention that you might need. You'll be asked for your immunization record. You'll be asked if you have any dental work that needs to be taken care of, or optical care. And for women, there will be a women health session. So there will be some physical assessment as well that your primary care provider will look into, check your ears, eyes, throat, will see your heartbeat, blood pressure, and will also measure your height and weight. And we'll put all this information on your chart so that it could be used in the future by your primary healthcare provider, whoever that is, a nurse practitioner, a registered nurse, or a family doctor. So after this medical assessment, you will be also asked in the initial screening, you'll be asked question about TB, which is one of the fatal diseases. So if you have ever had TB or if you have ever been exposed to TB, so you'll do a test. And that is basically a skin test that determines if you have tuberculosis to see if your lungs have been exposed or infected by tuberculosis bacteria. The results might either show something positive, which means that after up to 72 hours, you'll see the part of the skin where it was treated. So you'll see something hard or also a reddish color. So that means that your result is positive. Unfortunately, that needs urgent attention. But in some cases, that might also mean that you have been exposed to tuberculosis. But in either case, in Canada, you go for a treatment, and the treatment is between 3 to up to 9 months. Sometimes it could take up to 9 months, but for 3 months, usually you will be taking some antibiotics. Now, why you need to do that? Because bacteria can remain inactive in your body for years. Let's say even if you have been exposed. When your immune system becomes weakened, then TB can become very active, and it produces symptoms such as fever, weight loss, coughing, night sweats. And if you don't treat that, so studies shows that after HIV, this is the second deadly disease. So when someone is vaccinated, now the next thing is your immunization. And immunization is basically your vaccine record. So when someone is vaccinated, they're very likely to be protected against targeted diseases. But not everyone can be vaccinated because there could be some people with underlying health conditions that weaken their immune system, such as cancer or HIV, or who have severe allergies to some vaccines components. They may not be also eligible to take certain vaccines. But then we still could protect these people if we get vaccinated or if they are surrounded by people who all have vaccines. As parents, it is a responsibility of parents to make sure that their children are vaccinated. And some vaccines that are common for children is, for example, chickenpox, whooping cough, measles, mumps, rubella, polio, hepatitis A, B. So these are very important vaccines. And also as adults, we are taking some flu shots. It's very common in Canada to take flu shots in fall before or times leading to winter because flu and cold is very common in Canada. So adults do take flu shots, but they are not mandatory. Now, immunization records are very important to keep it on hand, especially parents need to have their children's record and they are responsible in a way to keep them up to date because you are required to show your children's immunization record to schools in order for your children to go to school. This is mandatory. Make sure you keep those records until your child is 18 years old, and they will notify the school if a child does not have the updated immunization record. I mean, the public health will notify. And understand that when the next vaccination is due, make sure that you make an appointment for your child and make sure that the vaccine is done on time. Some clinics also could fax you and could call you if your child's vaccine is due. But let's say you don't have an updated record for your child, so then the Ottawa Public Health will contact you or will contact the clinics. So make sure to ask whether or not they will be updated if your you could basically walk with your kid's immunization record to the family doctor or any primary care provider and check with them if your children's records are up to date. Sometimes you might get a letter from your child's school saying that the immunization record is not up to date, and the child should stay until their service provider connect the child with the wherever place where the vaccines are administered. So now let's talk about health coverage. So in Canada, we have OHIP and we have IAFHP. Let's say an IAFHP is more for the entire Canada, because IAFHP is a federal program, but OHIP is more for Ontario. So when you have a health coverage like OHIP card, which is your health card, you do not have to pay out of your pocket. So basically any person who is resident in Ontario or lives at least 5 months in 12 months of a year is eligible to have Ontario Health Insurance Plan, in short, OHIP. As a newcomer, your caseworker can help you apply for OHIP, but remember that if you have newly entered the country, you might be eligible for OHIP in 3 months after you living in Ontario. Because every state has its own card, its own health coverage. OHIP is particularly for Ontario. So that's why it's called Ontario Health Insurance Plan. But as a newcomer, upon your arrival, you will have IAFHP. And IAFHP will talk about it a bit later. So let's first discuss what IAFHP has and some of the responsibilities towards this plan. So because OHIP is covered by taxes. So each year the government, and somehow this money goes into the system to trickle down and help you pay for the doctor's visit you make every time, and also to cover for the health costs. So therefore, it's our responsibility to not share our OHIP card with anyone. Although our OHIP card, as you can see, it has a picture and your date of birth, but let's say there could be identical, like let's say twins, right? But again, it's very important that you do not share your OHIP card. If you do so, that will result in loss of benefits, and you could also be charged criminally. So if you lose your card, get another OHIP card and report it as lost. You'll need appropriate documentations if you're applying for a new card. So you'll be usually required to present at least 2 pieces of ID. And renewal notice, let's say you still have your card, but it has expired. So when it expires, the Minister of Public Health will usually send you a notice 2 months before your card expires, and you could apply within those 2 months to renew your card. Usually you'll get an envelope, or if you have signed up for online program, you'll get an email, but usually you'll get an envelope with the form which you need to fill, and you could do it online, submit it online for the online form, or for the hard copy, you could drop it at any Service Ontario office. And the other thing that you need to make sure that your card is still valid is to call the Service Ontario office and have a new OHIP card when you change your address or phone number. That means that you still need to go through this procedure to have a replacement card. So what is covered by OHIP? OHIP covers many services. For example, your hospital, doctor's visit, when you do your blood work. It also pays for emergency care, all the visits that you do at your doctor's office, and visits with specialists, and probably most hospital costs. Let's say you are referred for some diagnostic tests or lab reports, imaging. So these are covered by OHIP. And also immunizations that are publicly funded, they are also covered by OHIP. So now let's talk what is not covered by OHIP. So the OHIP does not cover your prescription drugs. So let's say you're sick, you visit your doctor, the doctor writes you a prescription. Unfortunately, your prescription is not covered by OHIP unless you are a senior. And that is a different meaning that your age, you're retired, 65 plus, or you are on ODSP, disability benefits, or Ontario Works, that would. But in general, it does not cover your drugs, your medication. It does not cover cosmetics treatment. It doesn't cover physiotherapy if you need. Dental is not covered, and also orthopedics care is not covered. Let's say you are calling an ambulance and you say, you think that that's an emergency, you call ambulance. So you still with OHIP, you will be covered for the ambulance, but let's say that was not an emergency and your doctor determines that was not urgent, then that means you will have to pay for that. So you always have the option of buying private plans to cover for the things that are not covered, like drug or medicines by OHIP. If you are working, some employer also subsidize extended health care plans, and you could definitely use that. But also notice that most of the subsidized extended health care plans by your employers will also pay a percentage of it, most likely 70, 80, up to 80%. But you still will be responsible to pay some towards your drug. Next, please. So now let's talk about Interim Federal Health Program, or in short, IAFHP. So IAFHP is a temporary coverage for 1 year, and this is federally funded. So basically with this, the sheet that you see on the screen, if you have this sheet, so you could get health benefits anywhere in Canada, you will be covered. But this coverage is only for 1 year. So when you come to Canada and you have this sheet, you could use it for up to 1 year. And then probably at this time you are you're eligible to apply, or you will have already received your OHIP. So when you have received your OHIP, then this sheet will not be valid anymore. That means you will be using your OHIP when you are in Ontario. But let's say if you are in Ontario, you're a resident of Ontario, you have been living in Ontario for at least 3 months, which is the main criteria, and you go to Alberta on a trip, and you stay there for a month, 2 months, or some time, and you get sick, and you go to see a doctor, or you go get help at a hospital, what would happen in that case? And now in that case, you still could use your OHIP, but then the doctor office or the service provider will give you some kind of information. Now it depends from state to state, and you could then send that to the Ministry of Public Health, or in Ontario, or they will do it for you. And then that state of Alberta will be funded. So that's the difference. You could go with your OHIP to a different state for a visit, not as a resident, and you could use your OHIP there as well, but that needs to be further processed, and you make sure that you follow up with your doctor on how that is carried out. Now, let's go to the next slide. Now, interim federal health program gives you basically the same coverage as your OHIP card does, but with some more benefits. Now, as I said earlier, this benefit, this sheet is only valid for 1 year, and then it expires. Now, in this 1 year, some of the benefits that you have access to, we as health service providers, we always encourage our newcomer clients to use these services because these services will not be available to them when they transfer to OHIP. So some of the services are, for example, most necessary medical treatments, medical tests that will not be covered by OHIP, but here they will be covered. Prescribed medication, as I said earlier, your medicine is not covered by OHIP, but here it is covered. Valid, and again, as I said, it's valid upon your arrival. And also it will cover your optometry and dental, but again, something that is urgent, that needs urgent attention. It is not, let's say you want to do hygiene. Unfortunately, oral hygiene is not covered by this. And you need counseling sessions. So several, I believe up to 5 or 7 counseling sessions are covered by IAFHP. Physiotherapy, again, some limited clinics do offer physiotherapy, and they have been designated, those clinics have been designated by IAFHP, they accept IAFHP, and you could go for physiotherapy session. But it also gives you coverage for prescription medication. When I'm saying prescription medication, it's important to know that there could be different prescription medications. So some might not be covered and others will be covered. And when you do that, so usually your doctors knows what medication is covered and what not. Probably we'll talk a little bit later more about this topic. So we can go to the next slide, please. So now healthcare facilities. There are different healthcare facilities. In a way, you could access your health by calling 911, and that is for emergency. When I say emergency, it is a very emergent situation, and I'll come back to it later. Then we have walk-in clinics, which I'll discuss later, and family doctors, hospitals, and community health centers. So these are the different facilities that you could use to get health services. But when you are sick, what you could do, you could call to Telehealth Ontario. It's a toll-free number. It is 1-866-797 and 4 zeros. I should have had that on the slide, but so when you call this number, again, it is 1-866-797-0000, so 4 zeros. So when you call them and you don't speak English or French, you could say no English and you say the name of your language. Let's say Arabic. No English, Arabic. No English, Pashto. No English, Dari. So because they have services in 110 languages, so they could help you. And you discuss your health issues with them, and then from there, they will help you where to go and what to do. And also you could look for a family physician as well, if you don't have a family physician yet. Now, family doctors and nurse practitioners is the other source that you could go. So as a newcomer, the settlement agency that works with you, let's say a Catholic Center for Immigrants, right? They are working with you. And after they have dealt with the settlement, then they will refer you to any healthcare facilities. For example, CCI directly works with ONHC, the program that I work with. So they will refer you there for the initial medical assessment, which I talked about earlier, to establish your health history. And then they are going to take care of your health needs for the first few months until you're able to find a family doctor. Now, again, Telehealth Ontario could also help in this regard. And you will be assigned a caseworker, and the caseworker could also help you to connect with a family doctor or nurse practitioner. So when you have a family doctor or nurse practitioner, make sure why it's important to have a family doctor. This is important because your family doctor will have all the information from your initial medical assessment. So the clinic will transfer your file to your doctor. And then all your health records will be with one particular facility, which is very important. And you will be assigned to that primary healthcare provider until you want, until, let's say, you are moving to a different location, a different address. That means then you can transfer to a different family doctor or a different nurse practitioner. So that's why it's better to have one family doctor, so all your records are in one place. And the other is the walk-in clinics. Let's say you don't have a family doctor and you need urgent help. You have developed rashes or you have fever, you just don't know what to do. So you go to walk-in clinics, and I'll talk about this later. And then, or also you could go to community health centers. Now, community health centers are partner organizations that are funded by government, usually the Ministry of Health, to provide services to the community member so that the load is taken off from the hospitals. And also it is because they're working with the community members in the community, in the catchment area, they are more accessible. And then hospitals. Hospital would be something that I'll go last if I'm sick, because there's a long wait time. Even in the emergency, sometimes you'll have to wait up to, I'm not discouraging you, but up to 10 hours. And you would not want to do that. Up to 10 hours sometimes. It's unfortunate. That's why community health centers comes in handy. You go there, you don't have an appointment, but you go there and you get help. And again, I'll talk a little bit more about this. Okay, now we can go to the next slide, please. So. Now 911, as I said, I'll talk more about this. So you can call 911. You could ask for the ambulance, and the ambulance will come if you want. They'll take you to the hospital. And as I said earlier, if the doctor says that it was not urgent, it was not an emergency, then you will be billed for that ambulance. And usually it is 75, 80, up to 90. The cost varies, but you will be billed. But if it was declared by your physician as an emergency, then it will be free. So what you should know when you're calling to a 911, they will ask you if it is fire, if it is police, or if it is the ambulance that you need. So you need to say, let's say fire or police or ambulance. Then they'll ask you, where is the emergency? So you need to have your address with the zip code, postal code. So that is very important. Try not to be discouraged, even if you don't speak English. If you have your address, they will know which address to go. So that's why we always encourage newcomers to give the address when they call 911. And calling 911, you know, it could be a desperate situation. So try to stay as calm as possible and give the information that will bring you help. So as I said earlier, language could be a barrier, but as much information you could provide, don't worry about the language, about whether, you know, you will be understood or not, but you should try your best to provide as much information as you can. Especially your full name and also your address. Then the dispatcher will listen to you, and they will tell you what to do if you are dealing with a patient. And also if you are dealing with fire, they will also instruct you, and you will be asked not to hang up. So please be with the dispatcher as long as you can, and until you get the help. Next slide, please. So appointment information. Let's say now you want to book an appointment with your doctor. You have a family physician, and you want to book an appointment. What are the things? What is some of the information that you have to have for your doctor? When someone is calling you to let you know about your appointment, make sure you take down the important information, everything that the doctor gives you. And if you have any question to the caller, please ask your question. Do not assume that your caseworker who is calling you on behalf of the clinic or on behalf of your doctor, or that they will understand everything about you. So try to give as much information as you want to share, and whatever questions they have for you. It's not always so straightforward when we are talking about something. Because there could be many other clients, and we could be easily confused with information of another client. So that's why it's very important that you have all the information about you or about the person who needs help or who needs an appointment. You provide that information. Also, it's important to get all information about the appointments. If you do not understand, then request an interpreter, or say, as I said earlier, say no English. If you just say yes to every question, they will assume you understand everything, and you will extend, you are then expecting that what you are saying will happen, or they are expecting that you are complying to whatever you have been told. So if you don't understand, do not say the word yes. Say no English, say you need clarification. It will then become, let's say you're saying yes to everything, then that will be your responsibility, and you have to follow through. However, if they realize that their message isn't being passed on properly due to language barrier, then it will still be their responsibility to make sure you have the appropriate information. The service provider will then make an effort to reach you again with an appropriate source, probably using an interpreter, or to pass on the message to you in whatever way you will be able to get the message. So that's why make sure that make sure that all your information is with you. You know what is the date of the appointment, the time of the appointment, who you will be meeting at the appointment, the name of the doctor. Ask if you need to bring anything with you. Let's say you're on medication, ask if you should bring your prescription. So follow all the information in the instructions that is given to you directly, either through your service provider or through an interpreter. Then before the appointments, once again, when you go to appointment, you should look for a few things. Make sure you know who the appointment is for. Some appointment may be just for you, and some appointments could be for your entire family. I personally have seen that sometimes the appointment is for the entire family of 7, yet it's only the one parent or 2 parents that come. So the doctor has booked let's say 3 hours to see 4 or 5 family members. And if only the parents are there and the rest of the family is not, that means we have taken literally someone else's time to access the health services. So make sure that who else will be coming to the appointment. So be prepared to have everyone's information when you're coming to that kind of appointment. It's also useful to write everything, write down it on your paper or, record it on your cell phone. And also, again, for every appointment, make sure you have your OHIP. Don't assume that once you have your OHIP card, so that is on the machine, on computer. No, every time when we go to a doctor, we show our OHIP card or IAFHP. So make sure you always have that with you. Okay, we can go to the next slide. Okay, now walk-in clinics. Now let's say you don't have a family physician, or you have a family physician, but the family physician is on leave. Or the family physician is just not available, but you're sick and you need help. You have some kind of fever, or you're coughing, and or you have severe headache that you have taken over-the-counter pill like Advil and Tylenol, and it's not helping either. So then these are the walk-in clinics. You visit the walk-in clinic and you don't have to book an appointment. Every walk-in clinic has its opening hours, and they are first come, first serve. So basically, if you are the first person, you will be seen first. If you are the third person, you'll be seen after 2 persons. You need care for minor illnesses and injuries, including infection and rashes, and you cannot wait for your family doctor. Again, this is a good place to go and seek help. You have fractures or emergency contraceptions and advice you need to have, or stomach upsets, or you have bruises or cuts, burns, strains, sprains, skin complaints, and you cannot wait for your family physician. Again, walk-in clinics can help you. Since you do not need an appointment, that's why we always suggest that you first see what is the nearest walk-in clinic. And sometimes you could Google search and say nearest walk-in clinic to me, or walk-in clinic near me. So that will show you where the nearest walk-in clinics are. And walk-in clinics as well, they have OHIP, they accept your OHIP card. There are some walk-in clinics that they may not accept IAFHP. So you should also take that into account. That's why if you are sick, try not to comply with your sickness. Try not to ignore it. Try to get help when you could be cured and your health could be restored than getting deteriorated. So next slide, please. Then walk-in clinics procedures. Patients should provide OHIP cards at the registrar. If you don't have an OHIP card, then they'll ask you to pay for the services. So you will be paying from your own pocket. And there is no guarantee that you will be reimbursed for that. So that's why it's always important that you carry your OHIP card or IAFHP. Check in the patients as I said earlier, as first come, first served, and always provide them with the name of your doctor, your family physician, or your primary care provider. Let's say they need some tests and they need some more information, and you don't have that information on you, so then they will contact your primary care providers. Maybe the doctor is away, but the clinic is still working. So the medical officer will get back to your primary care provider at the walk-in clinic. So pharmacy. Now we have another presentation for pharmacy. It's going to be tomorrow. So there will be a lot of more information about the pharmacy, but in short, know that the pharmacist will give you medication based on your provider, based on what your provider has prescribed. So in many countries, clients or patients could go to the pharmacy and say, I'm sick, and I have these symptoms, and based on the symptoms, the pharmacies will prescribe medication. But in Canada, that does not happen, and it is illegal. It never happens, basically. So therefore, you could only take medication from pharmacy, the prescribed medication for pharmacy, when you take your prescription to the pharmacy. Pharmacists cannot dispense medication without the approval of your provider. Let's say you do have your bottle of medication, pills, and you have run out of your medication, and you're taking that bottle to the pharmacy and saying, yeah, this is a prescribed medication. If the bottle does not has a refill on it, so again, that means that the pharmacist cannot give you another bottle of pills or medication unless it has a sign that says a refill for 2 times, 3 times, 1 time. So it's best to always go to one pharmacy for all your medication, because then they will have your record, and it always comes handy to the pharmacist as well. They know who your primary doctor is, and they know when you will be running out of your medication. And also something new with the pharmacies is that they take a small amount of fees. So whenever you run out of medication, they will contact you. They will contact your service provider, let's say the doctor or the nurse practitioner for a refill. But again, not all pharmacies do that. There are some pharmacies that they have just started the service. And once you have your medication, although the doctor who has prescribed the medication will tell you what is this medication for and how often you should take and how you should take it. But even when your medication is filled and it's ready for pickup, your pharmacist can again explain to you what this medication is for and how often you need to take and how you should take it, empty stomach, with full stomach, and everything that applies. And also the pharmacist will talk about the side effects too. If you have been taking a medication, but your doctor has explained it to you, but you still have forgotten, and let's say at the pharmacy, no one has also volunteered to talk about that medication, you could request, say that I'm taking this medication, but I'm not very sure, although my doctor has said something, but I need explanation, or I have these few questions I need answers for. They'll definitely come and help you. Next slide, please. So IAFHP coverage for medication. So as I said earlier, IAFHP, OHIP does not cover for your drugs, but IAFHP does. So if you have coverage from IAFHP to get free prescription medication, then you should not need to pay for the medication. But there are 2 kinds of medications. One could be generic and the other could be a specific brand. So usually the generic medications are covered, and the doctors also know that most of the doctors would know that you are on IAFHP, but let's say for some reason it has not come to their notice, you should always tell your doctor that you have IAFHP. So once the doctor knows that you're on IAFHP, they will know what medication to give you. They will make sure that the medication is covered. But that does not mean that the doctor will prescribe you any cheap medication that will not be that healthy. No, that will not be the case. It will be basically a generic medication or a medication that is not a particular brand. But also the physician, let's say you go to the pharmacy and the physician thinks that this medication is covered, but for some reason it has been moved from the covered medication list. So then you talk to the pharmacy and say, I have IAFHP and I cannot pay for this medication from my pocket. So can you talk to my physician to give me a replacement? And most of the pharmacies will do that. So they will get back to your doctor's office and they will request for a replacement for you. So that is something to really take into account, that not all of your medication will be covered. But again, let's say you still really want the medication that is not covered, but you do want that. That means that you will be paying from your pocket. Once you pay from your pocket, know that there will be no reimbursement. There is no way for that money to be reimbursed to you. So that means that you have the medication, but you have paid it from your pocket and you'll not be reimbursed for it. Thank you. Next slide, please. Okay, now to the very important point, and that is your responsibilities as patient. Well, yes, you do have rights and you do have responsibilities. And to make our health system more beneficial and more accessible to all of us, I think we definitely need to be responsible patients as well. So you can do a, let's say, annual checkup. You can do that at your doctor's office. The annual checkup, although that's not mandatory, but you could do that. And your doctor is, let's say, in your annual checkup, there's something that your doctor needs to have some more information about. So the doctor might refer you to a specialist. And that might take some time. So that means that if you, let's say, are, okay, you have the specialist information, the doctor has given you information that you'll referred and you'll hear from this doctor within 2 weeks, 3 weeks, a month, or 2 months. And then you hear, and then you forget about that information. And then when it is time for you to visit the doctor, you forget about that and you don't show up. What does that mean? That means that we have not respected the time. So there's two things. No show means, or late show means that you will have to pay from your pocket. So you don't go because you just don't remember, right? So that means no show. And the doctor's office will still bill you for that. Or you arrive, but you arrive, let's say 10 minutes later, 15 minutes later, 20, half an hour, or an hour, or 2 hours later, regardless of what has happened. Again, depending on the practices, you will be paying something, I believe, or you will be rescheduled, but you might not be rescheduled for that visit as soon as you originally wanted. So that's why respecting time is very, very much important. If you are referred to a specialist, expect a long time, because that is very important. Sometimes to see a specialist, it could be up to 6 months and even more. So therefore, it's important to remember that it is health system. There are so many people that need those services. So those whose needs are urgent, they are seen first, or priority is given to that. But it does not mean that they are forgotten and that they will never get what they need. And that's why, I mean, we have a free healthcare system. And we certainly are grateful for that, but it also means that it could not be that quick when we need the service, but the thing is that you will eventually get the services, unless you feel that, no, you need to be taken care of soon, urgently, and you don't hear from specialists. So you could go back to your doctor and say that, you know, my symptoms are going bad, or, you know, I'm afraid, I need, you know, some immediate help. And then the doctor will see if you could be connected to a different specialist. But remember that the healthcare services are there to help us and to make sure that we live healthy and that we have control over our health decisions. So you should make sure, again, to show up on time. And if you, let's say, want to cancel an appointment because something has just happened, there is a family emergency and you cannot go to the doctor's office to your meeting, then you could call and cancel the appointment. Again, it depends from a practitioner to practitioner. If it is, let's say, a specialist, they will say, okay, if you're canceling an appointment, let us know a week before your appointment. And if there is, there could be some practices that they may say, inform us 72 hours into your appointments, or might say, at least let us know 24 hours prior to an appointment. But let's say there's something that is not in your control and it just happened. Like a few days back, there was a bad accident on the highway, and the clients could not get on time. So they arrived to the clinic 3 hours later. Only one, and it was a huge family. So only one of the client was seen, and for the rest, the appointment was rescheduled, and there were no penalties. And so make sure that if you are canceling, know what your practitioner, what time frame does your practitioner allow you to cancel an appointment. You cannot cancel an appointment the very last minute. And you want to talk to your doctor, and you have some, there are terms that are used and you don't really understand what those terms are, and it also involves signing on some paperwork, and you really don't know what you're signing. So you as a client have the right to ask for interpretation services, and you as a client also have the right to say that I need time to understand what this is all about. So you certainly can do that. You don't have to sign on things that you don't understand what they are for. So as a client, you do have that right. And most of the community health centers and also hospitals, but many facilities will have interpreter services, but probably not the private practitioners or walk-in clinics or specialist office. So you could request for one, and that will help you understand what this treatment is about, and whether you consent to going for that treatment. Yeah, so we can go now to interpretation services. And as I said earlier, interpretation is something, we're luckily a very diverse country with hundreds of languages spoken everywhere in every city in Canada. So especially with newcomers, there are newcomers that they may not be speaking English or French, but they definitely need health services. So again, all these facilities are there for them to access the services. And because, as I said earlier, our Health Navigator program was created to bridge the gap between service provider and also service users. So our program also has an interpretation service. it's not only our program, but there are so many other programs in the city that provide interpretation services to health facilities. So the Ottawa hospitals in Ottawa, they are mandated to have interpretation service. Let's say you are in a hospital and you need interpretation service. So please ask for it. Sometimes people sitting at the desk, at the reception desk, they may not know if the hospitals have the interpretation service, but if you ask them, they will look into what is available. So you could get the interpretation service. Sometimes, if you need the interpretation service that very minute, that means that you will not be able to access an in-person interpreter, but you could use over the phone interpretation. And a lot of community-based organizations and settlement agencies, community health centers, they all have interpretation services. Hospitals do have interpretation services. As I said earlier, the private practices and specialist offices and walk-in clinics may not have, but if you are a client of any of these community organizations like CCI or CISO or like my program, ONHC, so you could talk to your caseworker and say, I have an appointment with a specialist and I need interpretation service, and we'll make sure that you have an interpreter for that appointment. And also, let's say you don't feel comfortable sometimes with an interpreter, you also have the right to say, that you are not comfortable with that interpreter. So you can change your interpreter, but also make sure that we do not have many interpreters for a single language. But I just want to make sure that you know that you have the right to say no to a particular interpreter. You could request a different interpreter, but there's no guarantee that you will get one. So that's in regards to the interpretation service. Now, if you need any kind of service that as newcomers, that we could help you, the Ottawa Newcomer Health Centre, you could go to our website, and our website address is www.onhc.ca, and you could refer yourself directly to any of the services that you need. Let's say interpretation, let's say health navigation, advocacy, health education. You could go directly to ONHC website, go on the Health Navigator's page, and you could do a self-referral. So where you'll put your name and what kind of services you need, and any additional information, as well as your contact information, and our office will contact you. And even if we cannot provide that service instantly, you still will be contacted and will be notified what are the next steps for you. And there are some other resources, just like our program. These are also some important numbers to remember. And for example, 911, as I said earlier, community and social services, you need any service. So it's the 211 number, Service Ontario, Telehealth Ontario, Ottawa Public Health, Ottawa General Hospital, Civic Hospital, Montfort Hospital, Queensway Carleton Hospital, Children's Hospital, Mental Health Crisis Line, Mental Health Helpline. And again, if you need some more information, you could always contact your caseworkers and they'll be happy to help you. So now if there is anyone who has question, I'm happy to answer. ډیره زیاته مننه د تاسو د اشتراک نه په دو ویبینار کې که چیرې تاسو کوم سوال لرئ نو کولی شئ هغه په چت کې ولیکئ او زه به ډیره خوشحاله هم ستاسو جواب درکم. باز هم بسیار زیاد تشکر از اینکه شرکت ورزیدین در این ویبینار. اگر کدام سوال داشته باشین میشه که در چت بر من بنویسین. من خوش میشم که بر شما پاسخ بگویم.
شكرا لك صديقة. ندعوكم جميعا الآن إذا كانت لديكم أي أسئلة ممكن أن تطرحوا أسئلتكم باللغة العربية أو الإنجليزية. If you like to ask any question, you can ask it in English or Arabic or Pashto, Dari, and Sadiqa is here to answer. Thank you so much, Sadiqa, for your time and very comprehensive presentation.
Thank you.
We have a question, actually. Does our card cover the dental services for the underage? So I'm assuming this is 18 and younger.
Yes. So the OHIP, if you're 18 and younger, you will have, I think, child smiles, something. Yes, so your children will be covered, and you know, age 1 to up to 18, and that will be free.
So this is a program. This is a special program for dentists.
Yes, and your children will get it automatically. So it will come to your mail. The card will come to your mail. And you will be automatically qualified. Let's say you don't get one, please talk to your caseworker and they could apply for one for you.
So what do you mean that everyone gets it? Like anyone has children under 18?
So that the person must be a resident. If let's say I'm a resident of Ontario and I have children, so in my file, there will be my children, right? And they would know that, and then there would be my child's OHIP card, and they could determine the age. So they will also send you that coverage as well. As long as I have OHIP, I am part of the plan. I'm part of the program. But let's say I don't have OHIP, or my OHIP is expired, or I don't have, I'm not a resident of Ontario, then I may not have. But sometimes, just in case, sometime could go wrong in the system and you may not receive one. So that's why it's always good to check with your caseworker and say, you know, my child does not have the program for his or her health dental coverage, and the caseworker will be happy to help.
So just to clarify, when you say caseworker, you are assuming that someone came as a refugee or a certain program, that there is an organization of settlement working with them, right? But if not, if they are just newcomers, didn't come as refugees, they came with other kinds of programs, they may not. They probably have to apply for it and
yeah, so that's why there is this number 211, so community and social services. Let's say they don't have a caseworker, but they just heard about this program and they want to apply. So they definitely could call 211 and they say, I have a child, I'm resident of Ontario and my child does not have the coverage. They will help them if they don't have a caseworker.
Somebody has raised their hand, so I'm going to unmute them.
Hello?
نسمعك. Go ahead.
Okay. يعطيكم العافية أول شيء. ثاني شيء أنا بدي أسأل، عندي ابني عمره 2 و7 تقريبا، مريض ربو. يعني هون حللوا إنه هو مريض ربو. نحن هسه ما إلنا السنة هون. بدنا صرنا طالبين من الشركة أكثر من مرة إنه بدنا يعملوا لنا شفاط بالبيت ويجوا يفحصوا لنا إذا في رطوبة ولا لا، وطلبنا من المشفى هذا الشيء بس على أساس إنه يعطونا الورقة وما عطونا إياها. وبدنا نوصل للمرشدة الاجتماعية بالمشفى تبعيت الأطفال، ما كنا نقدر نوصل. شو الحل؟ قالوا لي بالمشفى انه هني راح يعملوا لي ورقه مشان انا اجيبها على الشركه، بس لا هني اعطوني الورقه لانه انا ما بعرف احكي انجليزي، ولا انا قدرت اني اوصل لها، ولا بالشركه عم يرضوا يرجعوا يركبوا لنا الشفاط.
انهي شركه قصدك؟ شركه البيت البنايه اللي انت عايشه فيه ولا شركه
ايه نحن التاون هاوس، في شركه مسؤوله عن البيوت هون. صرت طالبتها اكثر من مره لهذا الشيء وما عم يرضوا يجي يعملوا لنا اياه. في بيوت فيها شفاطات تلقائيا، في بيوت لا. انا طلبتها فقالوا انه هني ما دخلن بهذا الشيء لانه هني استلموا من شركه ثانيه.
طيب انا هوجه لك السؤال واشوف هي عندها رد لدوت ولا لا. So the question is, she has a son who has asthma, and someone told her that maybe if she install in the house ventilation, so when she cooks, like it doesn't like spread the smells and make him feel more sick. And somehow she thinks that the hospital, there is a caseworker in the hospital who could write a paper for her so she can get funded if she provides this paper to her townhouse management department, that they could, like some houses have it, so her own house doesn't have it, but the management is saying you should get us this paper. And she is wondering if this could be funded by any organization or if there is any ideas that you can help her with.
So I don't know of any particular organization that funds devices or support services like this, but I know that if the child or the son has asthma and the caseworker in the hospital and as well as the doctor writes a support letter, and that there have been times that they get help, so they could then take that letter to their caseworker, and the caseworker usually knows, because at the city there are some programs that they have some fundings for needs like these, but they are very, very limited, and only those service providers, they are not highly promoted, but they're depending on the availability of funds, they would support that. The city itself has, we have had cases like this, but the city, it's not the very promoted a program that is promoted, but they definitely have some miscellaneous, I don't know under what kind of funding they do support.
But you are confirming that the hospital's doctor should write the paper or her own family doctor?
As many support letters and documents, the better. So definitely the doctor who is working directly with this client, the social worker who is working with this client, who is assigned to this client, and also their family physician.
هي بتقول ان ما فيش مؤسسات معينه خيريه او كده بتعمل الموضوع ده. هي بتقترح ان يمكن يكون يعني الحكومه المحليه نفسها هي اللي ممكن تقدر تعمل ده. عموما انا احب ان انا اتابع معاكي اذا كانت يعني السيتي اوف اوتوا الحكومه المحليه نفسها ان هي عندها فند، عندها اموال مخصصه لحاجات زي كده، انا اللي اقدر اتابع معاكي لان احنا اللي بنشتغل مع دوت. طبعا ده مش القسم بتاعنا، لكن ممكن انا احاول اسالك اشوف لك ان كان دوت في دعم الاشياء اللي زي كده ولا لا. مش عارفه انت عندك الواتساب بتاعنا، الواتساب بتاع دائره الصحه العامه؟
يمكن عند جوزي. انتوا تبع الصحه العامه؟
احنا اللي بنبعت الرسائل بتاعه الصحه على الواتساب باللغه العربيه. لو انت عندك الرقم ده سارة, if you could put the number again, the Arabic WhatsApp number, so if people have any questions or anything related to health they can like reach us through that. بس يعني طبعا ده مش شغلنا احنا، لكن انا اقدر اوصلك بالناس اللي هم ده ممكن يكون شغلهم، وممكن يكون في مخصصات ماليه للحاجات اللي زي اللي انت بتتكلمي فيها دي. فلو ان انت تتواصلي معايا على الرقم اللي دلوقتي هينزل على الشات، ممكن احاول اسالك في الموضوع ده.
طيب
شكرا حبيبتي. إذا كان في أي أسئلة أخرى بخصوص الصحة ونظام الصحة في كندا، أو أي تعليقات أو أي حاجة ما كانتش واضحة في العرض التفصيلي اللي صديقة عملته النهاردة.
بخصوص الصحة،
تفضل.
نحن حكوا لنا إنه رح يتابعوا معانا مشان يشوفوا الأولاد شو أخذين مطاعيم من قبل، وإذا هني أتم المطاعيم ولا لا. بس كل ما نحكي للدكتورة بتقلنا إنه راسلوا وزارة الصحة. نحن ما بنعرف نراسل، يعني نحن جدد بالبلد، المفروض إنه يعني نحن إذا ناقصنا شيء هني اللي يهتموا فينا، نحن ما بنعرف نراسل، ما بنعرف نحكي اللغة.
ان انت لحد الان الابناء بتوعك مش معمول لهم الملف ده، مش متجدد الملف بتاع التطعيمات. انت ما حطيتوهوش على الانترنت ومحدش بيعمله لك، مش كده؟
ابدا. وحتى اعطيتهم اعطيتهم مطعم الكورونا الاول، وعطيتهم تبع البرد، هذا لقاح البرد يعني. مع نحن ماشيين نظامي تمام، بس كل ما بسألهم انه انا كيف بدهم يتابعوا معنا مطاعيم الاولاد وكذا، بيقولوا لي انتوا راسل وزارة الصحة. نحن ما بنعرف نراسل يا جماعة، نحن جدد. انا بحكي لك مطاعيم الاولاد اللي
العادية، التطعيم العادية ديت
حتى
اللي
يصير عمرهم 2 سنين.
ايوه، دي التطعيمات ديت ايوه، لازم فعلا ان انت تبقى عندك ملف وان هي تحط فيها التطعيمات بتاعت كل طفل. ديت في اجراء كده لازم يتعمل، ده حاجه. وان اذا كنتوا انتوا اخذتوا تطعيمات الكوفيد 19 الكورونا، ده موضوع تاني، ده ما بيخشش في الملف ده. فهل عندك انت اطفالكم اخذوا التطعيم دوت؟
الكورونا اخذوه، كلهم اخذوه.
ده لما اخذتي وصل ولا لا؟
اخذنا وصل.
خلاص، هو ده. انت مش محتاجه بقى تعملي اي حاجه تانية. انت بدل معاكي وصل، انت هو دوت، هو نفسه اللي انت بتقدميه لو بتروحي بيه في اي حته وعايزه تخشي، وبيقول لك اديني دليل، اديني اثبات ان انت اخذتي التطعيم. وانت اعرفي كده ان انت اوتوماتيك على طول من غير ما تعملي اي شيء، مجرد ان الطفل بيبقى اخذ التطعيم او الكبير الشخص البالغ اخذ التطعيم، بيبقى تعمل له على الموقع بتاع اونتاريو الشهاده بتاعتك، والاثبات موجوده على الموقع اوريدي. انت بس مش عارفه تخشي على الموقع وتطبعي الشهاده دي من الموقع. لكن انت لو عرفتي تخشي، وانا ممكن اساعدك في الشيء دوت برضه من على الواتساب، ممكن اعلمك ازاي تخشي وازاي تلاقي معلومتك موجوده على الموقع بتاع اونتاريو. فدي حدوته ما تقلقيش منها. التطعيمات بتاعت كوفيد 19 اذا كنت اخدتيها هتلاقي اوريدي متسجله، مش محتاجه تعملي حاجه انت فيها. انما التطعيمات بتاعت الاطفال ده في اجراء لازم يتعمل.
انا على المطاعيم مو تبع الكورونا، انا على المطاعيم اللي من لما يخلق الطفل
العاديه
عمره 2 سنين. هاي المطاعيم اللي انا عم بسال عليه، لانه انا عندي اولاد بسوريا، ما بعرف اذا كان مكمل ولا لا، لانه اصلا اوراقهم ما معي، لانه راحوا يعني بالاحداث.
طب ما هم هنا مش هيقدر يقول لك حاجه اذا كنت انت نفسك اللي مش عارفه هو اخذ التطعيم ولا لا. فاذا هو هيعتبر ان انت ما خدتيش، ان الاطفال دي ما خدتش اي تطعيمات.
ما هني لازم يتابعوا، هني لازم يتابعوا معاهم. انا الاولاد اللي معي كروتهم، الاولاد الصغار معي الكروت، اما الكبار ما معي الكروت تبعوتهم.
Okay, so Sadiqa, she is talking about the immunization record, that she has like some kids younger than 2, there are older kids, but till now no one is following up, no one is updating the file. She doesn't know how to do it. No one, like when she talked to the caseworker, he or she like seems to be telling her, you do it. You have to update it with the health ministry, as she says, like. So in this case, when like your caseworker doesn't really provide that much support, and I personally know that I had to put my own child's report online, like no one really like offered to help, like we are asked to upload it online and keep uploading it every time we get like the child vaccinated, that we upload it by ourselves. So I also imagine if someone cannot do it, he doesn't have the language, he doesn't have like the capacity, technology or anything, is there a way that like someone would help them?
Sure. So in that case, we could, as multicultural health navigators, we advocate on behalf of the newcomers in the community. So this client could do a self-referral to our program, and we could directly get in touch with her caseworker, or we could take her directly as our client, and then we'll help do this.
And this is regardless of where she lives?
As long as she lives in Champagne region, as long as she is in Ottawa.
يعني هي بتقول إن هي منظمتها هي من أحد المنظمات اللي بتقوم بالمساعدات دي، من النوع ده من المساعدات. فإذا كنت أنت تحبي إن هي تتواصل مباشرة مع الشخص اللي هو مفروض بيراعي الحالة بتاعتكم، المؤسسة، أنا ما أعرفش هي أنهي مؤسسة فيهم اللي كانت بتعتني بأسرتكم من ساعة ما وصلتوا، وهي من خلاله تقدر تحاول إن هي تتفاهم معاه وتساعدك في ده، أو إن أنت ممكن أنت تبدأي تتواصلي مع مؤسسة بتاعتها هي مباشرة وتبقي عميلة عندهم هم، يعني تبقي من هنا ورايح تبقي هم الناس اللي بيساعدوكي في الحاجات الصحية. إذا كنت تحبي ده، أعتقد هي بتحاول تحط هي حطته فعلا، الرابط موجود دلوقتي على الشات، إذا يعني اضغطي عليه هيتفتح لك بره الزوم وتقومي تقدري تخشي. إذا كان ده برضو صعب عليكي، مرة تانية بقول لك ابعتي لي على الواتساب على الرقم ده وأنا هساعدك إن أنت توصلي لها بطريقة أسهل من كده.
So I just put the link of the referral form on the chat.
Yes, I mentioned that to her.
Yeah.
And I also offered that, like, if she couldn't apply through this link, that I will help her connect with you directly through WhatsApp. Like she can, because I think she is my client on WhatsApp.
Okay. And our health navigator speaks Arabic, so it works with Arabic community.
يعني هم عندهم برضو ناس بتتكلم عربي، هم مش دائرة الصحة، هم مؤسسة تانية، منظمة تانية بتساعد الناس. ف يعني ممكن أنا بس أساعدك إن أنت تبقي عميلة عندهم.
أوكي إن شاء الله. شكرا كثير.
أوكي حبيبي، شكرا.
يعطيك العافية.
لا، اتأكدي بس ان معاكي الرقم. انا اعتقد ان انت عندي، بس اتأكدي ان انت فعلا عندك الرقم ده، وان انت ضيفاني على الواتساب، مش على رقم تليفون، يعني مش تتصلي او تبعتي رسالة على التليفون، لا بتبعتي على الواتساب نفسه، الرقم
طيب.
اللي هو 613-229-3359.
ايوه تمام، صورت الشاشة وحفظت الرقم.
خلاص جميل، شكرا.
شكرا كثير، جزاكم الله خير.
الله يخليك. إذا الجميع مسموح له الآن أن يأخذ المايك ويسأل بأي لغة يحب. If you have any more questions, you can take advantage of the very little remaining time. Okay, seems we don't have more questions. If you like to add anything, Sadiqa?
Yeah, well, thank you so much for having me again. We have another session, I believe, for doctors and pharmacies. So please join us tomorrow, I believe, around the same time, Heidi?
Yes, tomorrow at the same time. So thank you so much, Sadiqa. Really, we appreciate your time and your knowledge and experience in this field. Thank you so much. Thanks, everyone.
Bye.
And we have, bye-bye, dear. We also have evaluation form. If you like to click on the form, you can let us know how did you think about this session and what else could we do, what other like improvements or any comments you have about this session. في لينك رابط دلوقتي محطوط على الشات، إذا كنتوا تحبوا إن أنتوا تملوا الشيء دوت، هو زي تقييم للجلسة، تقولوا لنا آرائكم، إزاي ممكن الحلقات دي تكون أفضل، إيه الأشياء اللي ممكن نعملها، أو إذا كانت عجبتكم، إذا كانت مفيدة، نحب إن احنا نسمع آرائكم. لما تتك على الرابط هتلاقي، لما يفتح معاك الرابط هتلاقي إن أنت ممكن تغير اللغة، في اعلى الشاشه على اليمين بتلاقي ان انت في لغه عربيه، في انجليزي، فرنسي، كل اللغات موجوده، بحيث ان انت تقدر تكتب التقييم بتاعك للحلقه ديت او لاي حلقات اخرى، اي جلسات اخرى حضرتوها معانا في سلسله الحلقات اللي احنا عاملينها في ديسمبر. وزي ما قلت في الاسبوع القادم هيكون معانا 3 حلقات تانيين، في 2 منهم هيكونوا مع اطباء، طبيب وطبيبه، في حلقتين منفصلتين. نتمنى ان انتم برضو تشاركونا فيها. شكرا لكم جميعا، ونلقاكم على خير.